Hello students, as per your request, today we are going to deal with National Family Health Survey 5. As usual, our channel will deal with National Family Health Survey 5 in the form of mind map. Basically, remember 6 things when you write about National Family Health Survey. First one is, what is National Family Health Survey? About it, we have to write. Second one, who is conducting this National Health Program? Third one is, what are the goals of this National Family Health Survey? Fourth one is, what is the funding for National Family Health Survey? Fifth one is, what is the history of National Family Health Survey? So these are the 5 things which can be written easily. But the last one is, what are the key findings of National Family Health Survey? And this will be dealt with under 10 subtopics. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Under 10 subtopics, I am going to deal with the key findings. So first one is, what is National Health Survey? National Health Survey is a large scale country level multi-round survey conducted in a representative sample of the population. So the key points here is, it is a multi-round survey, large scale, and it is conducted in a representative sample. That is the first point. Over. Second one is, conducted by whom? Obviously, Ministry of Health and Family Welfare has designated Institute of Population Sciences, Mumbai, as a nodal agency for conducting the survey. They will recruit some field level organizations. So, it is Ministry of Health and Family Welfare. Under this, they have recruited IIPS, International Institute for Population Sciences. This is the nodal agency. Third one, what are the goals? We have 2 main goals here. First one is data. It provides valuable data to Ministry of Health and Family Welfare for planning and policy making purposes, because we need data on health and family welfare. Second one is to provide information on emerging new issues in health and family welfare, something new which has not come to the notice of the government before, that can be brought to the notice now because of this survey. So these are the 2 broad goals. But under these goals, we get various data. Data on fertility, infant and child mortality, practice of family planning, how much it is, maternal and child health care, reproductive health, nutrition, anemia, utilization of health and family planning services. So basically all these things are covering under maternal and child health. So write the broad goal and then write the sub-components. We get state level and national level data on those 8 sub-components. So I will write 8 here. So goals over. Next one is funding. Obviously, when the Ministry of Health and Family Welfare is conducting, who else is going to fund? If you ask, there are many international agencies who are funding this program. For example, Bill and Melinda Gates Foundation, they are funding. USAID is funding. UNICEF is funding. UNFPA is funding the program. So we have many international agencies funding this National Family Health Survey program. So the 4th part is over. The 5th one is, what is the history of National Family Health Survey? This is National Family Health Survey 5. So obviously we had already conducted 1, 2, 3 and 4. So NFHS 1 was conducted in the year 1992 to 93. NFHS 2 was conducted in the year 1998 to 1999. NFHS 3 was conducted in the year 2005 to 2006. The last NFHS 4 was conducted between 2014 to 2015. The history is slowly the capability of data coverage is increased from NFHS 1, 2, 3 and 4. Actually, the specialty of the last NFHS 4 is that is the first NFHS which covered all the states plus all the union territories. All the 29 states, 6 union territories are covered under NFHS 4. And for the first time in NFHS, district level data was collected only from NFHS 4. 640 districts data was available because of NFHS 4. Now coming to the latest NFHS 5, the data was already collected and the data collection part is over. It is over in the year 2019 to 2020 itself. The data was completely collected, but thereafter COVID came. So because of COVID, a special phase 2 of NFHS 5 was conducted, and that data was released in the year 2021. In the month of September, we had phase 2 results of NFHS 5 because of COVID. And NFHS 5 included huge amount of data. Actually, the NFHS 5 was aligned towards the Sustainable Development Goals. So remember that Sustainable Development Goals. So the 30 Sustainable Development Goals. The NFHS 5 was aligned towards that goals, and NFHS 5 collected the performance of the previous programs and what is the new requirement under the program for health problems in our country. And NFHS 5 included some new data on preschool education, disability, access to toilet facility, death registration, bathing practices during menstruation, and methods and reasons for abortion. So these are some of the new data which are included under NFHS 5. So I think if you write this much about the history of NFHS, that is enough. Now we will come to the key findings of NFHS 5 under 10 broad topics. The first key finding of NFHS 5 is very special because it is about on sex ratio. NFHS 5 data shows that the sex ratio in our country is 1020 women per 1000 men, which is very special because right from 1881 we have never achieved this. The women number was always lesser than men, but this is the first time the NFHS 5 data shows the sex ratio as women higher than men. This is a national level average, but it varies from state to state. However, everything is not flowery because the sex ratio at birth is still skewed towards boys. For example, this is the second one. The SRB I will write. The sex ratio at birth is still 952 girls per 1000 boys. So this is very sad situation, and the states which have very low sex ratio at birth skewed towards boys are Uttar Pradesh, Haryana, Punjab, Rajasthan, Bihar, Delhi, Jharkhand, Andhra Pradesh, Tamil Nadu, Odisha and Maharashtra. These are the major states still skewed towards boys. But the third one is a happy news because India's population is going to face a decline in the future because the total fertility rate, our aim is, this is the third one, to bring down the total fertility rate to 2.1 so that we can achieve the replacement levels. The happy news is the 2019-20 NFHS 5 data shows that the total fertility is 2.0. That is, we have achieved the target, that is, it is below 2.1, but still in rural areas the fertility rate is still 2.1 only, whereas in urban areas we have come down to 2.0. In this, another important thing is because of this decline in total fertility rate, we are seeing a decline in under 15 age group. That is, from 28.7 per 1000, it has come down to 26.6 per 1000, the under 15 population in India. Fourth important key finding of NFHS 5 is the nutrition, basically the child nutrition part. In child nutrition, the stunting has come down from 38% to 36%. Wasting among children has come down to 19% from 21%. Underweight has come down to 32% from 36%. So these all are all India level data. However, unfortunately, the sad thing is the proportion of overweight children has increased from 2.1 to 3.4%, which says that India's population is going towards, the younger population is going towards overweight and obesity category. So we have completed 4. Now the fifth one is anemia. Remember, anemia is a major public health problem in India. Unfortunately, the incidence of anemia has indeed worsened, which means the incidence has increased in most of the states. Even at all India level, the anemia prevalence is increasing. In under 5 children, it has increased to 67% from 58%. It has increased to 67%. Among women, it has increased to 58% from 53%. It has increased to 58%. And even among men, the prevalence of anemia has increased to 25% from 22%. Except Kerala, all states of India are in severe anemia category, which means that the food taken by the population is not nutritious. The calorie is high, but the nutrition value is very low. Now the sixth one, what is the immunization status in our country? Thankfully, there is a substantial increase in immunization coverage level from 62% to 76% all India level, which is a very good thing. 11 out of the 14 states or union territories have more than 3/4 of their children fully immunized for their age, and Odisha with the highest immunization coverage in India, which is 90%. Odisha. The next seventh parameter which we are going to see is the institutional births. How much is the institutional births in India? This again has recorded substantial increase in NFHS 5 from 79%. It has increased to 89% all India level. Institutional delivery is 100% in Tamil Nadu and Puducherry and 90% in 7 states out of 12 under phase 2. Now the eighth one is family planning. What is the utilization of family planning services? Contraceptive prevalence rate CPR has increased from 54% to 67%, which is a very good thing. Use of modern contraceptive methods has increased in almost all states and union territories. Unmet need for family planning has decreased from 13% to 9%. Unmet need for family spacing in northeastern states has come down to below 10%. So which is also a good thing. Next, the ninth one is exclusive breastfeeding among mothers. Actually, the exclusive breastfeeding for children under 6 months has also increased from 55% in phase 4 to 64% in phase 5. So which says that the exclusive breastfeeding among children less than 6 months has increased at all India level, which is very good for reducing under 5 mortality and infant mortality. Last one is women empowerment. So the women's, if they are empowered, it indirectly indicates the development of a country. So how much is the women empowerment according to NFHS 5? This is measured by women operating bank account independently. This has significantly, very significantly increased from 53% in phase 4 to 79% in phase 5 at all India level. This is really a drastic increase. In fact, more than 70% of women in every state and union territory have independent operating bank account. The women have independent operating bank account. So these are the 10 important key findings under NFHS 5. All these things are discussed mainly for your exam purpose. I will just take a screenshot of this and put it in your video, and also in a description I will attach a PDF of this screenshot. Just see the screenshot, just recall, remember, memorize, and be a superstar successful student. Dear member students, please ask your doubt which video I should put next. I will put the video for you. Kindly press the like button for this video. Kindly recommend our channel to your friends also, so that they also can see these things. They can easily read community medicine and get benefited from my videos. Thank you very much.